Hello listeners, welcome to Views on Health. With me on the program tonight is Dr. Dhakshitha Wickremasinghe, Consultant Surgeon, National Hospital of Sri Lanka, and Senior Lecturer in Surgery, Faculty of Medicine, University of Colombo. We had Dr. Dhakshitha Wickremasinghe speak to us recently on surgical aspects such as preparing for surgery and care after surgery. But tonight it's going to be undergoing a colonoscopy. Having said that, over to you, Doctor, to introduce the topic.
Thank you. I'm going to talk briefly about a patient undergoing a colonoscopy because there are lots of things that a person need to understand when they're getting ready to have a colonoscopy. Like, why are they actually having it? How do you prepare for it? How is it done? What happens after the procedure? And the possible risks of this process. So a colonoscopy, as the name suggests, looks at the colon. Colon is the large bowel. Basically, that's the last part of your digestive system. It is divided into different parts: the ascending, transverse, descending, sigmoid colon, and the bottom end, which is called the rectum. A colonoscopy looks at the entire colon. We have another endoscopy called a sigmoidoscopy, which looks at part of the bowel. But if we suspect something wrong with the colon, we would recommend that you have a colonoscopy. So this is a test that looks at the inside of your colon, of your entire colon. That is a colonoscopy, and that is what I'm going to talk about. The process is actually, I'll talk about the process itself, what happens. So basically we use a device called a colonoscope, which is inserted through your back passage all the way up. In this process, for us to see inside your colon, the colon has to be distended. Otherwise, we cannot see all areas. So we may put air through that endoscope to distend the colon for us to get a better look. If there are any areas that are suspicious, where we think there might be something wrong, we can take small pieces using the same device and send them to be further tested at a lab. Those are called biopsies, and that is another advantage of a colonoscopy. When we do this, like I said, we examine the inside of the entire colon with biopsies of suspicious areas, and evidence or science has shown that if you undergo a colonoscopy, the risk of having a cancer for the next 10 years is quite low, a cancer in your colon. That is the actual process. And since we are looking at the inside, the colon needs to be clean. Under normal circumstances, your colon will have stool, solid or semi-solid stool. It is impossible for us to see inside your colon when it is filled with stool. And that is why correct preparation for a colonoscopy is important. I'll go into more detail about that because that is probably the single most thing that will determine the success of your colonoscopy. So those are the main things about colonoscopy.
So in other words, the patient has to then get into hospital and to be prepared for the process.
Yes. So the process of undergoing colonoscopy is slightly different to any other endoscopy for two reasons. One is because you need this preparation to clean your colon. Second is because it is done under sedation. Generally in Sri Lanka, we don't use sedation for other types of endoscopies. It is only for colonoscopy. Do they need to get admitted? Not necessarily. If they're okay to take the preparation at home, they can do it. and come to the hospital. But the problem is most people find it difficult to take that preparation, come to the hospital, so they get admitted the day before the procedure. I'll talk about the procedure, the preparation itself, to understand why it is difficult. So for us to clean the colon, we use certain medicine. The commonest type used in Sri Lanka is called polyethylene glycol. The trade name is Clean Prep. Basically, they come in sachets. You mix it like any oral rehydration solution or Jeevani into a 1 liter solution, and you need to take 4 of these bottles. Once you start taking this, it will clear your colon, meaning you will go to the toilet very frequently. You will get watery diarrhea and it will clear your colon. It is very important that you take these the way you were advised. It is not a very palatable solution, so often people are reluctant to take it. But the problem of not taking it correctly is that your colon will not be prepared appropriately for the endoscopy test. If that's the case, the problems are that we cannot see inside, or it's not safe to proceed. So we may either abandon the procedure entirely, asking you to come back on another day, meaning you need to take this preparation again, or the worst thing is that because it's poorly prepared, we may miss certain things in the colon because we were simply unable to see them. So that's why it's important that you prepare your bowel using the medicine and the regime we gave you. The other problem with taking this medicine is that it causes a watery diarrhea and you will lose water when you go to the toilet. So it's very important that you take sufficient liquids in between the laxative preparation to maintain your hydration. Because this causes a watery diarrhea, for most people in Sri Lanka, it is difficult to use public transport to get to the hospital. Because of that, a lot of people request to get admitted the day before and have the preparation at the hospital, which is what we commonly see in state hospitals. But if the facilities are available for you to take the preparation at home correctly and to come for the procedure in time, it's fine for you to do that and come.
So how much ahead would one have to prepare?
So if you're taking the 4 sachets, it takes approximately 7 to 8 hours for this process of drinking it. Plus maybe another hour for you to go to the toilet and then the time for you to travel. So basically you're looking at about half a day. If your test is early morning on a particular day, we might split your preparation for you to have 2 sachets the day before and 2 sachets on the day of the procedure. If your test is in the evening or late afternoon, you may have the preparation in the morning of that day. So but you're looking at roughly a half a day's preparation for this test.
And that would suffice?
Yes.
Thank you, doctor. So going on from there, so that patient is then ready thereafter to undergo the colonoscopy.
Yes. So when they come for the test, they may not get admitted to the hospital in the traditional sense, but you will be in the hospital, and when they come to the endoscopy area, we will check for certain things. We'll check for allergies, because unlike other endoscopies, you're going to have sedation, so we want to make sure you're not allergic to anything we use. And we'll also check about any medication they're having. Certain things won't affect the colonoscopy procedure itself, but may affect things like removing polyps. So if you're on blood thinners, common ones that are there are things like clopidogrel or warfarin given for heart problems. If you're on them, we can still proceed with the colonoscopy, but we cannot remove any parts from the colon. We can take biopsies, but not remove things. So we need to know in advance whether you're on this medicine. So once you come, the doctor who is performing this will talk to you, will explain the test, the risks, the benefits, and obtain your consent. It's a process of paperwork that you consent to undergo this test. Then you will be taken into the endoscopy suite, and if you already don't have a cannula into one of your veins, a cannula will be inserted and medicine will be given to you to reduce the pain and to make you sleepy. For most people, because of this medicine, it is not a painful condition, and because of these medicine that we gave you to sleep, often you forget or don't remember the procedure itself. So it's not unpleasant for you once you wake up. Once that is done, you will be given oxygen connected to a machine, and the test will start the way I explained earlier. We'll insert the endoscope from a back passage and keep looking at your colon from the inside until we come to its topmost end.
So is there a time frame for this, or it depends?
So the duration for a colonoscopy depends on how difficult it is and how long your colon is. Certain colonoscopies are done much faster than others. It also depends on why we're doing it. Sometimes we need to stop at different points and take biopsies for testing. So that would obviously prolong the time taken for a colonoscopy. But on average, you can expect it to last somewhere between 15 to 30 minutes for the entire test. We also need to, there are guidelines accepted worldwide that we need to spend approximately 8 minutes coming out of the colon from the point it starts, so that we have a careful look inside the colon. So obviously that would mean that the process would take 15 to 30 minutes.
And thereafter, once it's removed, and then the patient has to obviously rest for a while.
Yes. So that recovery period is more to do with the sedatives we used than the procedure itself. Once this test is done, you're obviously going to be still a bit drowsy or groggy because of the medicine. So you'll be kept in an area known as the recovery area, where the staff will still observe you, how your heart rate and blood pressure and the oxygen in your body are, whether they're appropriate and whether they're recovering appropriately. The medicine we use for this sedation are very short acting, so that sleepiness goes away very quickly. But we recommend that you do not drive on the same day. So if you're coming for this test, it's very important that you come with somebody who can take you home. It's fine to travel by public transport. It is not safe to drive. During this time, we will also monitor or look at your blood pressure, because that can change, and your breathing might change because of the medicine we give. All of these things are observed. Once you're fully recovered, the doctor will then explain to you what the findings were from the test, and whether any additional things were done, like for example a biopsy was taken, and what to do from that point onwards. If a biopsy was taken, the results of that biopsy will take some time, maybe a week, maybe a bit more. So the doctor will advise you to come back with that report. Sometimes, based on the appearance alone, we may be able to start some treatment, at which point we would start it. So that's going to be the discussion after the test that you've had.
Doctor, would you say that now if there is no necessity for a biopsy, then what happens? You don't do it?
No. So we only biopsy if we see an area where we suspect something, or in certain conditions, even if we don't see something, we want to check a part in the lab. Otherwise, for most colonoscopies, we will not biopsy. We will certainly not biopsy if it's not needed, and most colonoscopies will not need a biopsy.
So will the patient have any discomfort afterwards for a while even, apart from feeling drowsy?
So the main problem that you will find, you may feel some discomfort that is mainly to do with the air that we put into the colon. Your colon will be distended because we distended it to have a look, and we cannot remove all the air we put in. try as much as we can to remove most of the air, but not all. So there may be some air that's left, which will give rise to discomfort. And you will also notice that you pass an excessive amount of wind for the first day after the test, and that is all air that we put in. That's going to be the main discomfort. Colonoscopy is not a test that is painful, especially after the procedure, because once the procedure is over, there is nothing abnormal happening inside. And what you have to realize is your colon is not sensitive to pain in the traditional sense. Just because we take a biopsy and that it's like pinching, colon is not sensitive to that nature of pain. So it is not painful. So no, patients will not have pain. In fact, if you have pain, severe pain, worsening pain, that may be an indication that there's something going wrong. And that is the time for you to come back to the hospital or to see your doctor.
Is there any sort of particular age group that that one sort of basically does colonoscopy on as a doctor, or is it like done on children, young people, older people?
So colonoscopy can be done on anybody. Children may need colonoscopy, but when you talk about age, you're talking about screening colonoscopy. Screening is basically us trying to identify something sinister, most often a cancer, in people where you don't have symptoms of cancer. In all developed countries, there are national recommendations and guidelines for screening colonoscopy. Generally, depends on the country, may start at the age of 40, 45, 50. Some use certain other tests to select who will undergo a colonoscopy. But there are screening processes done. And that is the age cutoff. But there is no upper limit of age for anybody to undergo a colonoscopy. If there's a reason for you to undergo a colonoscopy, it has to be done. What are the common reasons? Well, it's mainly to do with symptoms that indicate that there's a problem in your colon. If your bowel habits have changed, if you've been regular in going to the toilet all your life, but all of a sudden you get constipated, or the opposite, you get diarrhea, especially if it's in somebody who's older than 60 years, especially if it's older than somebody more than 60 years, that would indicate that they would require a colonoscopy. The second symptom would be having bleeding from the back passage. The commonest reasons for bleeding are not cancer. There are things like piles. But we cannot exclude the possibility of a cancer just because we see piles. So that is another indication. Sometimes it may have nothing to do with your colon. Sometimes people complain of anemia or a low hemoglobin in their blood, in which case we need to find out where they're bleeding from. So they may undergo a colonoscopy. Same goes for people who are losing weight and we can't explain it. So those are the common indications that somebody might need a colonoscopy.
You talk of bleeding. Has it be a regular bleeding, or is it in fits and starts?
Any bleeding in anybody over the age of 60 years, even if they are known to have hemorrhoids, is significant. We never attribute it to piles or anything of that nature if they are older than 6 years, even if it is obvious that they are having piles. That is because the risk of having a cancer goes up with age, and we want to make sure that we are not missing a cancer. The risks of colonoscopy are far fewer than the risk of missing a single cancer. So even if you've noticed bleeding for one day, it is important that you meet a doctor. The doctor will most likely be able to decide whether that single episode of bleeding requires a colonoscopy.
So what is that bleeding, doctor?
So it can be any bleeding. So bleeding from the back passage broadly can be fresh bleeding, meaning it's bright red blood that you would see, or it could be altered blood or dark red or maroon blood, or clots, or dark or tarry stool or red color stool. If you notice any of these, even a single episode, that requires investigation.
Thank you, Doctor. So time is catching up with us, and it's been interesting listening to this process. Is there any sort of situation where you might want to do another colonoscopy?
Yes. If we do a colonoscopy and if we identify small growths called polyps, depending on the number of polyps, you will always require colonoscopy. When you would require it would depend on the number of polyps. If you had 1 or 2, maybe you'll have it in another 5 years. If you had more than 5, you would need one in 3 years. And if you had more than 10, you're going to need one in the next year. Same goes for cancer. If you've had a cancer and if you had the cancer removed, you'll need a colonoscopy the next year. And then it's a part of looking at your colon to make sure another cancer is not growing.
Doctor, just one more question before we wind up. If you take polyps, you said, and of course depends on the number of polyps and the tests that go. How do you treat it in the meanwhile?
So the principle is that we remove all polyps we see. So if we see, say we do a colonoscopy and we see 10 polyps in a person, we would remove all 10.
At that point?
At that point. And that would mean that we've removed 10 polyps, which would mean you would need another colonoscopy in a year. If we see 5 polyps, we'll remove all 5, but that would mean you will need another colonoscopy in 3 years.
So that means that process of the colonoscopy will take a little longer in that case.
Yes.
If you're removing the polyps.
Yes, that's why I said the time varies on what we do. Obviously, if we need to remove polyps, each polyp will add a few minutes to the process.
Thank you, Doctor. So what would be your take-home message once again?
My take-home message would be not to ignore symptoms that you notice. Don't attribute something like bleeding to hemorrhoids. It is possible that you're having hemorrhoids. It's possible that you've had hemorrhoids for the last 10 years, but there's no guarantee that the blood you're seeing is coming from that hemorrhoid that you're having. It is always possible to have a sinister problem higher up in your colon, which is the source of your bleeding, and that would mean if you attribute it to hemorrhoids or piles, that you are missing this. And what you have to remember is anything that is identified early has the best chance of a cure as far as surgery or medicine is concerned.
Thank you, Doctor. On that note of advice, we end the discussion on undergoing a colonoscopy. We're grateful to you, Dr. Dhakshitha Wickremasinghe, for being with us once again on the program as a consultant surgeon at the National Hospital of Sri Lanka and senior lecturer in surgery, Faculty of Medicine, University of Colombo. In the midst of a busy schedule, for sparing a valuable time to speak to us on these important topics. Thank you so much, Doctor.
Thank you very much.
Thank you, Manjula Seniviratna, for technical assistance. I'm Fatima Razi Kharda saying good night and hoping to catch you next Monday same time on Views on Health.